First things first, there are 1,864 cases of coronavirus. That's 17 more than yesterday. If I can take you through the breakdown as best we know it at this point, there'll be a further release from Annalise and Brett later in the day, once further investigative work has been done, once more is known about individual cases. But at a top level, there is 1 from hotel quarantine, 2 that are associated with known outbreaks, 3 that are the subject of routine testing, and 11 that are still under investigation. So what we can be certain of is that there will be some significant community transmission within those numbers. The exact amount of that will be determined following those processes that I've just alluded to. As we said on Saturday, and indeed again yesterday, this is still with us. This is not over. And I know and understand that so many Victorians, perhaps all Victorians, want this to be over. But we simply can't pretend that the virus is gone, that the virus is somehow not in our state. It is here. It travels so fast. It is so infectious. If people do the wrong thing, if people, for instance, have a positive test or are asked to quarantine because they're a close contact and don't do that, and then go and spend even a modest amount of time with others, it is almost certain that they will give the virus to other people. That is how fast this spreads. That's how infectious this is. That's the battle we're in. That's the challenge that we face. So what I ask all Victorians to do is the right thing and the smart thing. If you are sick, you cannot go to work. If you are sick, you cannot visit friends and family. If you are sick, there's only one thing you should do. Even with the mildest of symptoms, you should come forward and get tested. On the issue of testing, we've done now more. We've got results back because there is a bit of lag between tests done and results being processed in the lab. That's just a process of volume. 675,000 test results have come back to us since January 1. That is an enormous effort. There were 8,149 results received yesterday. That's very big for a Sunday in effect, because that'll be Sunday's testing, being Monday's results. We anticipate, and again, if we can provide you with further clarity with an exact number later in the day via the usual release that goes out, we will. But all of our rough tallies from testing centres, we think we've done something like 16,000 to 18,000 tests yesterday, which again is a very big number. I want to thank all of those Victorians who've come forward and got tested. I know there's been some delays. That's just a function of many, many people doing the right thing, and I thank them profoundly for what is a really big and powerful contribution to our fight against this virus. Coming forward and getting tested, even with very mild symptoms, really does give us the data and the evidence to do the contact tracing, to try and win this battle, to suppress as much as we possibly can and drive this down to acceptable levels, particularly when it comes to community transmission. Further detail about those testing numbers will be forthcoming later in the day. As you know, and Annalise can speak to this in more detail, but Brunswick East Primary School and Keilor Views Primary School, they've had students test positive at each of those, so they're in the usual way, they'll be closed. They'll be the subject of deep clean and all the other work, including the contact tracing that our 1,000-strong coronavirus detective squad will be engaged in and is engaged in every minute of every day. If you're sick, you can't go out. If you've got even mild symptoms, you have to come forward and get tested. And if you're asked to quarantine, you need to do as you are asked. Not just for you, because it's not just about individuals. This is about all of us. Everyone following the simplest of rules, cough etiquette, not going anywhere other than to get tested if you are unwell, keeping your distance, not shaking hands, not greeting people with hugs and kisses, not pretending, essentially, that this is gone, because it isn't. It is here, and whilst I'm confident that our public health team is doing everything they possibly can, they simply won't achieve the outcome that we want if people don't support them, don't help them in the work that they're doing, and if people don't work with me and the public health team to get on top of this, then we won't. And we have seen, as we said on Saturday, many families, large families, who have gathered in numbers beyond the rules. That is just not on. It is not acceptable, particularly if anybody in those family groupings has even mild symptoms, let alone if anybody in those family groupings has been told to quarantine as a close contact or even a positive case. Now, just on home, it's really important again, and I'll be grateful to you to again remind all of your listeners and viewers and readers, it is your household and 5 guests. And again, some common sense. It doesn't necessarily mean you have 5 guests around to your house every single lunch and every single dinner. Try and be sensible about this, given that regardless of small numbers who are doing the wrong thing, although I do think that there are perhaps larger numbers of Victorians who perhaps think this is a new phase and we can do things a little differently. It doesn't matter how many people are doing the wrong thing. Everybody will pay the price if we get to a point where restrictions, either localised or across the state, need to be reintroduced. I am very grateful to everyone who's doing the right thing, and all I can do is give Annalise and Brett and all of their team all the resources they need, and we're doing that. All I can do is ask Victorians to do the right thing by their family and every Victorian family. This is a challenge, but we're equal to it if we all do the right thing. You cannot, if you're unwell, pretend you aren't. You cannot, if you're Victorian, or indeed if you're anywhere in the country, you can't pretend that this is over, because it simply isn't.